So hello everyone. On behalf of the International Federation of Social Workers and the Social Work Action Network, I'd like to welcome you to the second international seminar on social work in the context of the pandemic. As you may remember, the first seminar was broadcasted a couple of weeks ago today. And back then, although there were some early indications that the event was going to be well attended, I think that none of us, the organizers, expected that almost 20,000 people would watch the discussion and participate to the debates. So in fact, the popularity of the event and the flow and the content of the discussion back then highlighted a couple of very important things. The first one would be that despite the almost worldwide lockdown, social workers and our communities, they do want and they do try to come closer. And they do so through smaller or bigger acts of solidarity and different events like the one we organized. And the second point was that the way our societies experience the impact of the pandemic has been very much political. For although the pandemic itself does not discriminate, the broader social and political structures ensure that poorer communities experience COVID-19 in very different ways to more affluent communities. So in a sense, structural inequalities or years of underfunding of the health and social care services, and of course, chronic and almost punitive poverty have become a life sentence to many. So now more than ever, we witness how poverty and inequality quite literally do kill. And the epidemiological evidence is now very clear and undisputed. So the focus of tonight's discussion will be exactly on this. So we would like to further unpack the social change element and social change focus of social work intervention. So we would like to hear from our colleagues, from our speakers, about how social workers are first-hand witnesses of the health and social impact of the pandemic, and how have social work practitioners and communities adapted their practices in response to those challenges. Once again, I'd like to remind you to visit the websites and the Facebook pages of the International Federation of Social Workers and the Social Work Action Network. A lot of activity and a lot of energy has been directed through those outlets. And without further ado, I'd like to introduce this evening's speakers. Today we have with us Kerry Caskelly, who is a mental health social worker from the Republic of Ireland. Jennifer Thompson, who is the executive director of New Jersey and Delaware NASPA, the National Association of Social Workers in the US. Sung-Pyu Kim, who's a social work practitioner and the president of the Daewoo Association of Social Workers in South Korea. Nikos Trimekliniottis, who's a professor of sociology and law in the social work department at the University of Nicosia in Cyprus. Fatima Oygun, who's a community organizer with the Coven Hill Baths in Scotland and a board member of the Romano Lab. And Ruben Macia, who's a local authority social worker and vice president of the Spanish Council of Social Workers. Now I would like to invite the co-host of this event, Mike Lavalette, say a few things on behalf of SWAN.
Okay, good afternoon or good evening to everybody there. I think I'm on. I just wanted to introduce a couple of themes that have arisen over the last couple of weeks since the last meeting. The first one is one of the practical things that people asked us how they could tweet about the event. And so if you are tweeting about tonight's meeting, either live or if you're watching it in video, please use the hashtag SWResponds, Social Work Responds, SWResponds. The second thing I just wanted to tell people about was that the journal Critical and Radical Social Work has made an offer for anybody who's viewing the meeting today. And so on the IFSW Facebook page and web page, and on the SWAN Facebook page and web page, there are details which will allow any viewer to get free access to the CRSW journal and to the editor's pick in those journal articles. The third thing I just wanted to point out was that after the success of our first meeting, we were inundated with requests from people for them to speak at one of these international meetings. We're delighted to have so many offers of speakers, and over the next period, we will try to invite as many speakers in as possible. The intention is that this will be a fortnightly international meeting, and over the next few weeks, then we will try to make sure that we have covered all parts of the globe and that speakers from right round the world are invited in to offer their contribution. The final thing for me to say before going on to our first speaker is just to think again about the theme of these meetings. If you were online 2 weeks ago, you'll remember that I said that for us, it was about the contrast and the conflict at the heart of crisis situations. On the one hand, there's writers like Naomi Klein who tell us that during crises and during pandemics and social crises, societies often find themselves in a state of trauma, social shock. And in that period of social shock, it's very easy for us to lose things that we had before. Welfare can become privatised. Big businesses see business opportunities to make profits. For example, around the making of ventilators at the present time, there are now lots of big organisations who have moved in to take government resources to try and build ventilators. Or perhaps it's the way in which the state has moved to roll back human rights. And during the pandemic, in country after country, we have been subject to quarantine and closed down. But what we have to make sure is that when we come out of quarantine, that the state's new rules, new regulations haven't pushed back our civil rights in any significant way. So on the one hand, Naomi Klein talks about the way in which crises can be used by the rich and the powerful to roll back our rights. But on the other hand, we talked about the writer Rebecca Solnit. And in a number of writings, Rebecca Solnit talks about what she calls the paradise built in hell. Looking at a number of disaster scenarios, Solnit argues that the assumption is that in times of crisis, people will behave very selfishly. They will look after themselves and their own. But in practice, she argues, what we start to see is a glimpse of a different way of organising society, of people coming together to support each other, to support communities. They push themselves beyond the norm to support those round about them. And for Solnit, what this is indicative of is that in hellish circumstances, we start to see a glimmer of a different possible world. And so what we've tried to do in the last meeting, and again tonight, is to ask our speakers to think about the ways in which the state and state social work are responding to the crisis, but also to think about alternatives, the ways in which communities and social workers as community activists can start to help to pose the question of building a paradise in the midst of this hellish pandemic. So that's the overarching theme that we want to think about in these meetings. Final thing I want to say is that, of course, as you listen to the speakers, you will bound to have lots of questions. And please ask those questions. On the SWAN Facebook page, please ask your question there, and then we will relay them to the speakers, and we'll have at least half an hour for questions at the end of the meeting. So, without further ado, I'm going to hand over to our first speaker, and our first speaker is Kerry from the Republic of Ireland.
Great. So I'm going to assume everybody can hear me. So I'm just going to look at, great. Okay, so I'm going to start by just giving you the current situation in Ireland in relation to COVID-19. So as of yesterday, we have about 12,547 COVID cases in the country. We have approximately 444 deaths in the country, and we have out of that approximately just under 3,000 healthcare workers who have been diagnosed with COVID. Here, like in many other countries, we are now in the middle of what we're calling a lockdown. So there are a lot of major restrictions in place across the country. So essentially everything has been closed down apart from essential services. So everybody is being made or being asked to stay at home. People are only allowed out for exercise once per day within a 2-kilometre radius of where they're living, and then to go get essentials like food or medication or some such. There are particular groups of people who are actually being asked to not leave their homes at all, even for exercise and even for essentials. These groups are people who are identified as being particularly vulnerable. So, for example, people who are over 70 and who are in very, very high risk groups, and they are being asked to do what's being called cocoon. So cocoon themselves literally in their homes or wherever they may be living, and to rely then on others, whether it be online shopping, or whether it be neighbours, friends, community groups, etc., for their essentials for the amount of time that we are in lockdown. The lockdown was started at the end of March. It was due to be finished last week, but it was then extended until the 5th of May and is going to be reviewed again then at that point. Just to note that our response to COVID is centralised, so everything is being managed through a national emergency public health team, and that then trickles down to all services and all local areas. One thing that has happened actually, which is quite interesting, is all private hospitals in the country have been made public for the duration of the COVID emergency. Also, unions are quite, I suppose, are quite important and integral to this work as well, and have been working quite hard to ensure that while people are supportive and workers are supportive of being as flexible as possible and being redeployed, etc., during COVID, that I suppose that the basic rights are still respected, and that people aren't asked to work outside their scope of practice. For social workers and employers during COVID-19, there are lots of guidance and documents and policies, etc., that are being developed and sent out for all healthcare workers, which social workers come under. But the ongoing issues, which I think are the same for a lot of social workers, is there's an ongoing lack of personal protective equipment. There is sometimes lack of clarity around safe working practices and whether people have to be physically in work or whether they can work remotely or they can work in altered form. And then there's also, I suppose, concerns around organisations actually, when the COVID pandemic came in, essentially closing down services where social workers worked and just telling people to go on annual leave or to stay at home until they were redeployed to do COVID related work. For social workers, as I said, health and safety are an issue. There are a lot of concerns about how vulnerable families or vulnerable children or adults can be safeguarded during the pandemic, given the fact that it's not always possible or feasible to physically see people face to face. So there is a lot of concern and worry about that. There has been a marked decrease in referrals to our child protection services, so TUSLA, which is the name of our National Child Protection Service, and also there has been a marked increase, which is global, in domestic violence in Ireland as well as other places. So they are major issues of concern for social workers. There's also issues of concern for social workers to be able to actually do their work in different ways, so to be supported to work in remote means or different ways, so being given the technology or the ability to do their work, whether it's through technological means or otherwise. And there's also then, because social work as a profession in Ireland is such a small group, there's also I suppose a concern about the lack of system acknowledgement of the role that social work can play within a crisis, both before, during and after it, specifically around psychosocial responses and the skill set of social workers to support people, whether they be families, communities, or people themselves impacted by COVID-19, especially around maybe death, dying, bereavement, and just that after effect of being through a traumatic event. And also social workers as healthcare workers and as essential healthcare workers are part of the people who are being redeployed to other services during COVID-19. So again, it's a concern for social workers to be able to be safe in those instances as well when they're being moved to different areas. In terms of, I suppose, responses that social workers have had around the country, there have been a few new, I suppose, initiatives or innovative ways of managing or responding to the crisis. So, for example, in medical social workers have developed guidance for social workers around the country to be able to support people who were in hospital during the pandemic, to support people who were either long stay patients, or I suppose to look at the specific aspect of being a support throughout the bereavement process or the death and dying process. Again, in hospice social work, palliative care social workers have developed guidance documents for social workers who are working in those instances, especially since social workers in those areas have developed specialist expertise in that area in terms of supporting people and families through that traumatic process and that change process in terms of grief and loss. In terms of mental health social work, there has been a number of initiatives around supporting, I suppose, the groups of people who may be extra vulnerable or extra marginalised. So I suppose coordinating events or coordinating at local level to try and respond to vulnerable groups who, whether by their mental health condition or their vulnerability or maybe their social isolation, actually need proactive support and response in terms of basics such as food, such as medications, such as I suppose being supported to access services that can support their mental health during the crisis. So social workers have taken the lead in a lot of areas around actually developing processes and guidance around that. In relation to maybe marginalised groups or other groups such as the traveller community, social workers have been involved in trying to support the community's mental health through the crisis by doing the things such as developing videos whereby we can talk through mental health issues or specific ways of managing anxiety and panic, etc., that may be in relation to the crisis as well. And I suppose in terms of human rights and mental health, another piece that social workers are aware of and are trying to be cognizant of and react to or respond to is the recent emergency legislative changes in Ireland, where people who are in approved centres in voluntary status, their mental health tribunals process has changed. So there's a concern that service users' voice and views are not being adequately supported or understood in that process now. So social workers are trying to respond to that and trying to get that actioned during the crisis. In terms of working with families, so a lot of social workers obviously would work with groups and would do a lot of group work with families, especially in mental health, but obviously in lots of other areas as well. So what has happened, because we can't all physically see each other, an NGO called Care Alliance Ireland, which is actually run by some social workers, actually responded to the crisis recently by moving peer support for families online. So they have in a very innovative way have started a Facebook peer support group for families and invited social workers, family members and various family care NGOs in to moderate and support that Facebook group. So a number of us are involved in doing that and have been providing support to families, anyone who identifies as a family carer since the beginning of the pandemic, to be able to support people in another way, because a lot of services have closed down. Families are very often the ones that are trying to do everything now and support their family member or their loved ones, but also not being able to get support for themselves or not being able to get support for their loved one. So to have that outlet, we have been getting feedback throughout the entire process, and it has been quite positive in the sense that families feel that they have somewhere to go, they have people to talk to who understand where they're coming from, and they feel there's a safe space there to get support. Another piece has been social workers trying to support families in community nursing units and nursing homes, where we have clusters of COVID-related cases now, and where there are a lot of trigger points, I suppose, in that area at the moment. So social workers are often taking a lead in terms of trying to develop a coordinated.
I'm mindful of time. You need to summarize your.
In relation to technology, then social workers are also trying to, I suppose, be innovative in relation to the use of technology, and we've done some work with some academics in UCC, in one of the colleges here in Ireland, around trying to gather together some resources for social workers in relation to accessing and using technology to support people throughout the crisis. And social workers are also doing that now. They're also doing telehealth and psychosocial support through technological means. Our national association, the Irish Association of Social Workers, has also been very supportive and very proactive throughout the pandemic, and has advocated a lot in terms of supporting social workers to have us named as essential workers, to make sure that we have access to PPE, and I suppose in general just to highlight the roles of social workers throughout the pandemic. So I'll stop now. Thank you very much.
Katie, thank you very much. That was a very interesting presentation of the wide range of interventions that social workers have been engaging with, and also the concerns about the lack of protective equipment. We're several weeks into the pandemic, and it's very worrying to hear that there's still these concerns. Without further ado, I would like to invite Jennifer Thompson from the United States to give us an account of what's happening in New Jersey and Delaware.
Hi, I'm going to assume that everyone can hear me, but I'm going to look for just a thumbs up. Fantastic. It's really difficult to know when you're talking to yourself. So thank you all for having me. This is an incredible honor, and I'm excited to share with the world sort of what we're doing in the United States. Unfortunately, I think, as everyone knows, the United States has the dubious honor of leading the world in the number of COVID cases and perhaps even deaths at this point. We, as a country, are very much so in the midst of a crisis. And while each one of our states is handling this a little bit differently, I think that by and large, we are mostly on lockdown. Here in New Jersey, we are sort of in the epicenter of it. I'm about 25 miles from New York City, so very much in the thick of it. And we've been at home for, it seems like a month and a half or 2 years. It's running together at this point. But social workers have really risen to the challenges here in the United States, and we have held very true to our core values of being open, accessible, and leaning in. And I think that's one of the things that I'm most proud of as our profession here in the United States. And I thought that I'd talk to you a little bit about the use of technology, because that's really the one way that we've come together. While I think as a country and just a collective group of social workers, we've been a little bit adverse to technology in the past, we very swiftly have moved to embracing it and leveraging it to build community in this sort of new world that we have. Some of the ways that we've done so have been a focus on bringing social workers into the homes of every American. And one of the things that we noticed very quickly, and that we know to be true about mental health, is that not everybody reaches out for supportive services. And while we're all going through this crisis, not everybody is connected with a mental health therapist or feels comfortable speaking with one. So this grief, this loss, this trauma that we're all going through collectively, you might be connected, but most people aren't connected with somebody. So we've started these things called community conversations. We bring in licensed clinical social workers to a Zoom platform online. You may see my son pop up, I'm sorry. It's just the state of the world that we have, folks. We bring in licensed clinical social workers who host conversations with the community. These are free for everyone. They share it in moms groups on Facebook. And it's an opportunity for social workers to talk about grief and loss and parenting during COVID, and what does it mean to juggle work, life, and all of these things that we're now faced with doing. And it's a really accessible way for the community to engage with a therapist, to get some language, some tools, some just sort of community comfort without that intimidation feel of contacting a therapist, which we know can feel really challenging and scary and overwhelming, and people might not be ready for that first step. But they've been given the resources, they know where to go for some more information, and then of course we can always connect them with a therapist to further talk about some of their needs. And that's been an incredible opportunity for our communities. 500,000 people are, or 5,000 people are joining these community conversations, which has been a really nice way for people to come together in a way that social workers are showing up for the community. And again, remaining true to our core values of being open and accessible, and making sure that some of those socioeconomic walls are not exist, by the ability to pay. Some of the other ways that we've come together also is around supporting social work in this new world. So we've been very fierce advocates in making sure that telehealth is available and that it's covered by insurance, and that all insurance providers are accepting telehealth, not only through video communications, but also covering phone sessions, and that people have access to those resources. But one of the things that we've also realized is that very quickly, social workers and clinicians needed to move private practices where they're working and used to being in front of people and might not have the infrastructure or just technological capability into this new world to provide these services. So as an association, we've really come together to provide training and resources to our social workers. And I keep saying this on repeat, but just because you can doesn't mean you should in the world of technology. But so making sure that social workers have the tools and the resources they need to do it, but do it safely, and make sure that they're continuing to protect themselves, but also the clients and the communities that which they serve. So making sure that it's HIPAA compliant and making sure that it's safe ways to communicate with your clients. And then also making sure that they just have sort of the tools and knowledge of how do you verify location when you're all communicating in this virtual space, and just really giving some very practical tools to our community. Some of the other things that we've been thinking about as a social work community is, while we're all living here in this moment of crisis, and that's what it is, we're all trying to respond to it and give tools and resources to the community and our social work, but we want to think beyond that as well. Because what this has highlighted for us is that it probably won't be the only pandemic that we experience or the only time that we're in this situation. So while it's great for us to respond now and we need to, we also need to be thinking beyond that. So thinking about the ways that we build virtual community, that we continue to do our learning online, that we continue to come together. And so some of the things that we've really started to do as a national social work community is provide our continuing education credits online, moving our conferences online. New Jersey has our first virtual conference in a week, and building together and bringing people together, even though we can't come together in a physical space, still giving people the opportunity to come together and dialogue and learn from one another in a virtual space, and building this new sense of community that might otherwise not exist because we're all confined to our homes. And the real beauty of some of this technology has been that, for example, our conference that's coming up would have normally been just a very state-specific experience. But now that we're in this virtual world, we can open up the virtual doors. We can invite people from all over the world together. We can invite our colleagues from different parts of the country together to grow and build and to learn best practices from one another, both in direct care during COVID, but also in utilizing technology and how are we doing this and building this sort of international community. And I think that that's one of the great things that's really come out of this crisis, is the ability to bring people together and for us to continue to be innovators and thought leaders in this space. And we keep saying that social workers play an integral role in all aspects, not just in the helping field, but they should certainly be involved in all technology conversations and how to use technology for social good. And I think this is one of those spaces and times where we really see the value in that. And I'm a fast speaker, so I'm actually going to turn over whatever time I have left to whoever else, and I'll just have questions. I'm happy to answer them and talk to you a little bit about what we're doing here in the United States.
So thanks very much, Jennifer. I think there's a couple of issues coming up so far in some of the comment feeds as well. One from Orni Loka asks, where can we get the guidance if we are now developing guidance in Ireland, in the UK, in America, and Germany? Where is there a central place where that can be gathered together and shared? And I think that's something that perhaps SWAN and the IFSW might want to think about after today's meeting, about is there a common space that we can put these various guidances together for people to share and have access to. I also think Jennifer's point about the use of technology for shared meetings like we are having today, this would never have been possible a few years ago, but now we can have speakers and contributors from across the world, and it really gets us to think about how we might host social work conferences in the future, rather than jetting everybody around the world, destroying the environment in the process, but rather staying in our home and participating this way. So thanks very much for that, Jennifer. And without further ado, I'm going to call in Kim to tell us a little bit about South Korea.
Hi, can you hear me? Can you hear me? Okay. Hello. Thank you very much for participating in this world-class web seminar. It's an honor and great privilege for me to be with you. Today, I would like to share with you how social work is like during the COVID-19 in Daegu, Korea, South Korea. Daegu is the most shocking place of the coronavirus pandemic in Korea. In early February, the largest number of confirmed cases occurred after Wuhan, China, and the mass infection of one religious group quickly paralyzed the community. Therefore, Daegu was compared of the second Wuhan in Korea. More than 6,800 out of 10,000 confirmed cases in Korea were confirmed in here, Daegu. At the epidemic center, there were the medical staff's direct effort at the front line, but our social workers were responsible for filling the social vacuum created by the corona crisis. The corona crisis, which killed more than 200 people, is hopefully entering the termination stage in Korea. What did social workers do in COVID-19? Well, when coronavirus spread widely, what did social workers do in COVID-19? You may know that all social welfare facilities have been closed according to government guideline in Korea for days. The elderly was unable to come to the senior citizens restaurants because of the social distancing measure and the lockdown of social welfare facilities. They were enduring this situation at their own home, like being on a lonely, remote island. Social workers visit their neighbors every morning with their lunch boxes and daily necessities for the most basic living. And we are taking care of people with the severe disabilities too. Social workers at living facilities committed themselves to take the prevention measure from self-quarantine. Others are taking care of the community, the neighbors, and the lonely persons. We are working hard for our underprivileged and isolated members of our community. We don't fight the virus directly like a professional medical staffs, but we protect our neighbors and make solidarity against from the isolation that infectious disease bring. I have been working to take care of underprivileged members of the community so that they can no longer be isolated, but connected and warm homes. How did social workers cope? Well, when coronavirus spread widely in 2.5 million population city, all social work facilities in the public and private sectors become panic-stricken. There was a shortage of daily necessities and volunteers to deliver our lunch boxes. At that time, Korean social workers sent goods from all over the country and sent donations that they got from fundraising raised. Not only the Korea Association of Social Workers, KASW, but also the Association of Social Workers in cities and provinces sent donations and emotional support. Social workers in the community centers did their best to sort and deliver these pouring items. Social workers at living facilities also prevented the virus by themselves participating in facility isolation. Some of them had children to take care of, some of them had families, but they gladly joined in protecting the disabled and the elderly in the danger group before them. Let me make a simple comparison for you to imagine how hard social workers in facilities have been trying. There are elderly care hospitals and nursing homes in Korea. There is a total of 258 nursing homes and 67 hospitals for the older person in Daegu. The number of beds of each type is almost the same as 15,000 beds. However, the number of confirmed cases in these two groups was quite different. There was 299 confirmed cases in the hospitals, while only 14 were confirmed in nursing homes. That's how much awareness, effort, and dedication have protected the elderly in the nursing homes where social workers are responsible for. There was no massive infection of nursing home residents in Daegu, which is a high-risk facility. And the level of collective infection in social welfare facilities nationwide is minimal. It seems that social workers are protecting well the clients. Nevertheless, COVID-19 asks a big question about the current social welfare system in Korea. The issue of human rights of social workers has been emerged. Strong measures such as cohort isolation could violate social workers' right for health care. Fortunately, no Korean social worker was killed by infection, but we have to remember that we are in the risky battlefield. I felt once again that we had a responsibility to protect the health right of social workers. Thank you.
Thank you very much, Kim, for a presentation that emphasized a lot on the value base of social work intervention. Thank you very much. There are almost 400 years at the moment in our live stream, and this does not include all the watch parties that we hear are happening at the same time. There's also very interesting discussion in the comment feed below the screen, and there are two main themes so far that emerge in the discussion. One is about the collective trauma and the mental health pressures that people feel and communities feel, and also the other theme is around social rights and human rights, and I think these are the two main pillars of social work intervention as they have emerged in the presentations. And I would like to invite Nikos Dimitriotis from Cyprus to give us an account of what is happening in Cyprus.
For this. I think I'm on now. Thank you for this. I think I need to unmute myself one moment. Okay. Thank you very much for this, for the invitation. I'd like to express also my solidarity and support for this very important initiative that is spreads the discussion, rather than not just the virus going viral, but ideas about how to respond to this virus. I'm going to focus on the issue of refugees, migrants, and the kind of new penalization regimes that are emerging at this moment in Cyprus, but also I'm going to refer to our region, Greece, and our region, which is facing similar problems. I think that what we're facing today is a serious problem. Because, I mean, Cyprus, for instance, which is a small island country divided by war, and it's sealed at this moment, the Republic of Cyprus has about 3,000 cases, tests, 3,000 tests, and 750. There were 3,000 new tests, and there were 20 new cases. Overall, we had 750 in total cases and 17 deaths at this moment. And this does not include the deaths of the Turkish Cypriots and the organization in the north, which is again a divided country. I think that what is important to bear in mind is that in this situation, there are different responses, and it's crucial that social workers as frontline workers in this process, together with the medical profession, with nurses, are the key to actually keep things going and reminding us that society has to be defended in different ways. Now I'm talking about, I would like to speak about, focus a little bit more of what is actually changing and how the responses are. The first thing is that we have new regimes of exception, of the exceptional situation and emergency results in derogation of rights. Now, part of it, this is understandable or acceptable because it's part of the fact that there is a need to protect, to contain the spread of the disease. At the same time, it's used as an opportunity for rights to be contained and to be reduced, and even for non-derogable rights to be refused, to not to be properly respected. What I have in mind is, for instance, externally, refugees who would like to come in, there's new pushbacks policies taking place. The pushbacks policy is actually denying the right to disembark after a and putting themselves in danger, denying the right to life. There's a policy of denial. This is happening in Greece, it's happening in Cyprus, and this is not something that happened just because of the coronavirus. The coronavirus, though, provided the best possible excuse for this to happen. I think it's very, very important that we take this on board, that what is happening now, it's taking previous policies and allowing this to occur in a kind of perfect storm sort of situation. It is an opportunity, or as Michael had said in the beginning, for this to happen. As far as the internal, what is going on internally, this is also important for us. It's important because, for instance, there are new detention regimes being created. I'm talking about how reception centers, which are supposed to be open reception centers, have become closed reception centers. In other words, detention. And this rhetoric had begun before the pandemic, but now it's being implemented in practice. And of course, there's very little resistance to this. Now, within those detention centers, within those places, these people are, the measures that are taken are not those that apply to everybody else. In other words, because of the crowding, and I would say not just overcrowding, but because of neglect of what is going on inside, the result is that they are being exposed to more dangers of the possibility of having of contracting the disease. Now, there's also another thing, which is a kind of conflation between refugees and so-called economic migrants. Now, on the one hand, those of you who are radical, we had a kind of a radical rejection of this binary between who is a refugee and who is the one who's forced by circumstances. But what we have now is a reactionary rejection, which is say, you know, the radical rejection said, open door policy, allow them all in. The conservative reaction, the reactionary section is keep them all out. We don't want them here, all of them, whether they're refugees, whether they are migrants. And I think this is also spreading like a virus. And this has happened before the coronavirus, the pandemic. If you look at Hungary, if you look what Salvini had done, and if you look at those who are emulating, our own minister was emulating this sort of policy. The third thing is a kind of, the fourth thing is about the way in which there is an attempt to close borders altogether, so limit the free movement. Now, in part, this is a policy of containment. In part, this is not. It is something much more dangerous. It's about closing down and giving hands to racism. So this is the part of the regime. The other part is to do with the new penalization that is spreading around. Social work is based not, I mean, the social work in the progressive dimension of social work is about solidarity, it's about support, it's about reaching out and creating an opportunity for this. But so the key here is not to go down the social control side. The idea that what we're doing here is to contain and to have the new penal regimes. And I think what we're seeing in Cyprus now with, for instance, criminalizing homeless people who are being arrested and fined, poor people, irregular migrants who try to go to work, these sort of people who are actually denied rights. So I think this, and my final point I would like to end is that what we're also seeing is a new labor regime emerging. Now, the new labor regime has an opportunity for us because the realization that we're in the crisis, we don't know what will happen next. We don't know how long we will be keeping this in this situation, but we do know that it is essential that we begin to think differently. Now, when we have EU commissioners calling for the nationalization of basic services, for the wrong reasons, of course, for not to be taken over by China, we see here that what we need to have is unlock our imaginaries in the direction that Michael has been talking about in the beginning, which is basically create the conditions for alternatives. Because what will end up after this crisis is already it's happening now, and it's together the collective action of social workers, of activists, of people who are critical, of people who want to change the world, that this alternative will come. Thank you very much.
Okay, thanks very much, Nikos. Very important, I think, to highlight the way in which European states, or the European superstate, and various different states themselves have used the COVID-19 pandemic to move even further against refugee communities and what we do to address those things. I'm now going to bring in Fatima from Glasgow.
Michael. Thank you, Michael. I'm delighted to be here, and thank you for inviting me. For those of you who don't know about Govan Hill Baths, the organisation I'm representing, we emerged about 18 years ago as a grassroots campaign fighting to save a vital, much-loved community asset from closure, a swimming pool. But our campaign was always much more than just saving a historic building from closure, but essentially a fight against the neoliberal policies and attitudes of a Glasgow City Council towards working class communities, where the term community, in their eyes, in the eyes of the policymakers and politicians, implied ghetto. And the success of our campaign really is a testament to the diversity and determination of a community, a fighting spirit, which has always been synonymous with the area of Govan Hill. Govan Hill, for those who are not familiar with it, is a highly deprived area with appalling health and social inequalities. However, it is also, for over 100 years, been known as the most diverse community in Scotland, home to migrants arriving from all across the world, known as the Ellis Island of Scotland, and is currently home to about 50 nationalities speaking 30 languages or more. It is also home to the largest Roma population in Scotland, and we think the UK. It is also, importantly, the second largest Muslim population in Scotland. And what we do know is that the coronavirus disproportionately affects the poorest and the most marginalised in society. And Black and ethnic minority people, those living in Govan Hill and the UK, fall into both those categories, where the Black and ethnic minority communities, particularly Roma, already have a low baseline of health and are overrepresented in many of the at-risk communities, i.e. those with underlying conditions. And one of the ways we've been organising and keeping the community together during the pandemic, I want to just briefly talk about. There has been an absolutely amazing level of communication between different groups, statutory organisations such as social workers and the NHS community workers already working in the area, coming together with local activists, community-based organisations like ourselves, and an amazing array of grassroots mutual aid groups that have suddenly sprung up organically by people wanting and, importantly, determined to help and reach people in need. Mental health helplines have been set up, phone trees, organising food parcel distributions, and I think within a week there was about 1,600 volunteers who'd put their names down to support all the work that was necessary. Within the Roma communities, we've been working very, very hard with Roma charities such as Romano Love and others to try and tailor services directly to meet the needs of the Roma community. For example, getting translations done in the languages people speak, so as to spread the message of safety, self-isolation, staying at home, etc. Everything so far produced by the NHS and the governments have been in English and have been in printed formats, which has been pretty useless really with communities with low literacy levels, and where communities like ours, where 50% of the people have English as a second language. So it's been left to community groups like ourselves and grassroots activists to make the videos, to short films, the posters, the phone calls, etc., to communicate the essential messages and also address the huge fears that exist about how the virus spreads. Also, many within the Roma and Eastern European communities are considered essential workers. They work in agriculture, in factories, and in warehouses. What this means is hundreds of them are traveling in buses together, mixing at work with hundreds of others, then returning to their homes, usually very, very overcrowded accommodation, where they live with their large families, and jobs where safety has never been a priority, certainly where there's no PPE and their safety is being catered for. Housing, so they return home to a housing which has always been a campaigning issue locally, a major issue where we have people living in very large families, often caring for elderly members of their families, sometimes up to 10 people living in 1 or 2 bedroom properties, often in slum conditions, where self-isolation, we are told to self-isolate, self-isolation is not an option. And we have been pushing, the local community groups like ours and Roma Charities have been pushing to use the thousands of empty rooms in hotels as accommodation to assist the community to be able to socially distance at this time to stop the virus spreading. In addition, we've been working with local primary schools, one local primary school where 80% of students are mainly from the local Roma communities, have virtually stopped learning because the schools have been unable to engage the pupils during the lockdown because students don't have laptops due to poverty or tablets. So we've been working successfully, I might add, working through lobbying politicians to secure more funding for the schools to distribute free tablets so they can be used for internet access. This also allows the school to make contact with children and their families, allowing them to gather evidence that assists in identifying the further needs of our community. However, we have experienced barriers. The main one being, not surprising to anyone, has been racism and stereotyping. There was a series of very high-profile fake pictures from many racists within the community claiming to show Roma people deliberately ignoring social distancing advice. They were published in a number of right-wing media outlets, causing a racist backlash on social media. And what this did is it caused a heightened atmosphere so that every time any group of Roma people were pictured, it added to the lie that they were behaving any different from any other member of the community. We have used social media and sympathetic contacts in the news media to combat this fake news, but it's often been very, very time consuming and energy draining for our volunteers, staff, spending time trying to combat and correct this racist bias. There is also a danger, which I think we should be aware of, that the same pattern will follow for Muslims during Ramadan when it starts very, very soon. Racists will be suggesting that mosques and Muslims will ignore social distancing. That lie will be widely spread, and we should be ready for that. The racism is, of course, not just individuals and the media, but also institutional, as we've seen in hospitals and in the NHS, where translators are not being provided when people present themselves with symptoms, and people who don't have English as a first language are unable to articulate how they feel. But there's also been much positive that has come out of this, and it's a glimpse really in a different way of working that I think we can hopefully look forward to beyond the pandemic. People suddenly have discovered that the government has always had lots and lots of money that they have denied communities such as ours. There has always been money to support the needs of our community, and the lie that is now being shown for what it was, a lie that austerity was absolutely necessary. And this new collective grassroots way of working has also demonstrated that people can do things very, very quickly for themselves, by themselves, and often in a much more coordinated and much more effective manner. People are, I think, when this finishes and we go into recovery, people will be expecting a seismic and systemic change in society. Thank you.
Thank you very much, Fatima. Your presentation really brilliantly presented examples of, or rather the importance of lobbying and advocacy as part of collective approaches to social work and empowerment of communities. Before we move into Ruben, I'd like to say there's been a couple of comments or questions in the Facebook chat about guides and information about how social work would respond to crisis. I'd like to say that in the IFSW website, there's a dedicated social work responses to COVID-19 crisis. And this includes country reports from many countries and examples of how social workers have adapted their practices. Also, national associations have a lot of resources about what is happening in their own countries. Barcelona, for example, has a dedicated section on the website with advice and home visits, etc. I'd like to bring in Robin Masia and tell us about social work in Spain, which has been hardly hit by the pandemic.
So thank you for being here and for do this possible. Just a bit about explain the context of Spain facing this COVID pandemic. I think Spain is one of the most affected country in Europe after Italy. Spain is the most affected country in Europe. So we are locked down from 1 month locked. So restaurants for sure are closed, also bars, kindergarten, universities, also schools are closed. Just supermarkets and first need administrations are open. Construction and production was closed, but just during 1 week. So this Monday they were opening again, construction and production like factories. So also in Spain, like in Netherlands, all private hospitals have been becoming in public hospitals. So also hotels have been becoming in converting hospitals. So I want to talk about social rights. Social rights. I think I would like to talk about social rights in times of crisis, but in the good way. So I think that in Spain, by the moment, social protection is growing up. It's growing up. Policies are thinking a lot about families and are protecting a lot families. So by the moment, if your private company cannot continue paying you your salary like a worker, the government will pay you the 70% of the salary. So This is so high protection. Also, if you are searching for job, if you are not working, and you are taking benefit of an economic protection of the government, this protection is going to be prolonged. Yeah, prolonged on the time. So also other example, if I give to some people economical small help just to pass the month, so this help, this economical help, is going to be prolonged automatically during 2 months. Yeah, so in general, I think that the policies are on the good way. So also, and I think that the most important about social rights in Spain today, the government have announced a minimum income. So it's a kind of universal minimum income for every family that is in need. So it seems that it's going to be around 500 euros per person in the family. So that's a very good news about social protection in Spain. So what's about social council and the organization of social workers in Spain? We are so close with the government. We are working together in developing policies, social policies, to the corona crisis. So I think this is a very good point, and this is so very important. Like our profession work together with politicians to develop very good policies. So weeks ago, government launched a kind of recommendations about how to manage social workers services or social services. It was focused on elderly people, childhood, families in need, and gender violence. Also, this communication talk about self-protection and telecommunicating. Yeah. So also about the social workers Spanish Council, we have created an emergency group. This emergency group is composed by expert people in emergencies, and they are working actively. And the aim of this group is like collect all the information about social issues, and also share with our colleagues this information. So keep professionals well informed. This is the aim of this group. Also promote the training, not just training on emergencies, just social training, social online training. So they have launched a lot of courses, online courses, and also they have like this kind of meetings like us. And for example, last week we were 2,000 people connected at the same time, just listening to this emergency group discussion about social items. Yeah. Also, the presidents of the associations of every community, yeah, they have a day to get together and to discuss about policies or about the situation in general in Spain. Yeah. Other interesting thing, this group have launched a research. We have launched a survey just to collect the impression and the needs and the situation of social workers across Spain. So by the moment we have 900 responses. We hope take values information through this research. Yeah. So now I want to talk, if I have time, I want to talk about the situation in the first lane. I mean, working with people face to face. Yeah, it's so hard nowadays. It's so hard. People needs it's a real issue. It's terrible. So my phone is ringing every day. People asking for help. So it's terrible. We have resources. But I think our resources, like personal resources or human resources, are limited. We are so tired. We are few social workers working, and I think after a month lockdown, people is more and more in need. So that's all. Thank you.
Ruben, thanks very much for that. That brings us to the end of the contributions from the speakers, but we're now going to turn to the various questions that have been fed into us. There's still time for questions as well, so if you're online just now, please do add your questions onto the Facebook feed. The question that I'm going to ask is for Kerry, and it's come from Zoe Kerry. And Kerry says, we keep on talking about social isolation and the pressures to isolate, but how do we support people who are isolating, and for those people in particular who are feeling suicidal? How can social workers work and support people at that time in their lives?
Sure. Well, thanks for the question. I suppose there's a number of different pieces, I suppose, for people who are actually within mental health services, and I can speak just from experience myself. What we have done, social workers have actually led quite a lot in terms of actually trying to plan and ensure that everyone, especially people who are isolated within mental health services and maybe feeling suicidal, are actually supported during this time. So we've led on kind of team-based responses. So in our area, we are actually ensuring that every single person that is attending the mental health service is proactively contacted and are supported in terms of all their psychosocial needs, and are linked with that, whether it's that they just need phone contact and they want to stay in touch with the team. They can get called daily, twice a week, 3 times a week, whatever the case may be, linking people to make sure they have food, linking people to make sure that they know what supports to contact if and when they need them. For example, crisis supports outside of the 9 to 5 working, making sure people can get their medication. So organising transport and making sure people just have all the things that they need, and I suppose linking them to things as much as possible. In cases where people are feeling suicidal, we're still seeing people face to face. So that's where I was talking previously about the need to make sure that social workers, as well as all other healthcare workers, have access to PPE and safe working practices that they're able to continue to see people who are feeling suicidal or who need to be seen face to face, because no matter what, we still are providing services that are face to face throughout the pandemic, and we need to do that as much as is needed. So we need to be able to be safe in doing that as well. For people who maybe are in the community and not necessarily formally in mental health services, there has been a huge community response in Ireland, and a ton of what other people have said as well, mutual aid groups set up. So just in my local area, I'm part of our local community mutual aid group, and essentially that's just people in the community coming together, and whoever has the skills or expertise will just offer that and support people as and when it's needed. So I suppose that's a way for people who are isolated to be supported. Our police, our Gardaí, are also checking in formally on people who ask for it, as well as our national An Post, our national postal service, are doing a huge amount of work in terms of supporting communities, whether it's just checking in on people that they know locally are isolated, or also linking them with services if and when when they're needed. So there are a number of different levels and a number of different ways in which social workers are involved in kind of supporting people who are socially isolated, who would have been isolated previously as well. So I suppose knowing the groups that may also be already marginalized and isolated and needing on that. So we're trying to do that. And even in the different ways, I think where other speakers, I think Fatima spoke about supporting people in ways that are appropriate to their community. So I'd spoken previously about we're doing kind of like video, short videos to offer support to members of the traveller community, so that they can actually proactively support their own mental health, but in a way that's appropriate for the community. So there's just some of the things that we're doing here in Ireland.
Thank you very much, Katie. I'd like to, there's a question for Kim, and the question is about the social change dimension of the social work interventions in South Korea. Can you please elaborate on this, Kim?
That's good question. There are a lot of positive changes through this COVID-19 situation. But if I choose one of them, in my mind is that our social intervention, we have built a strong sense of social solidarity within the community. For example, assisting community members to support one another. In this COVID-19, Korean social workers help each other. Social workers who are usually accustomed to receiving were able to donate their money for raising funds for another social workers in different provinces. It is sort of building a strong sense of bond with people who are more difficult than themselves as a social workers. If I suggest one more thing, this is a life and death situation, and the first priority is to preserve the life of the community members. Although the human rights issue of social workers was mentioned in my presentation, many social workers were willing to participate in the voluntary isolation because they thought it was important to protect the life of vulnerable elderly people. The COVID-19 has caused social workers to realize what they will never feel in ordinary situation. It is my answer. Is it okay? Thank you.
Thanks very much, Kim. The next question is for Jennifer, and it's come from Cecilia, who says that we've talked quite a lot about the use of new technology and accessing and working with people through the new technology. But her question really is, well, but what about those who are excluded, who don't have internet access? So Jennifer, wonder if you would like to comment on that.
Yeah, absolutely. I think it's not just an access to internet, but it's also an access to the devices that connect us to the internet, right? And there are a couple of responses I have. The first one is more immediately here in the United States, we're working with nonprofit organizations, we're working with government to make free public wireless available. And that's a huge lift for, I know, a lot of places, but I think the more that we can do that and make it accessible, the more opportunity we have to help people. But I think the longer term response to that is we as a profession have to be a bit more forward thinking and embracing technology now so that we can be leaders in this space. And I think we as a profession also need to be challenging corporations, large corporations, the Googles, the Facebooks, to make devices and give money and put funding towards making technology accessible, affordable to people so that when these crises happen, that people can connect in a meaningful way and there's no barrier in terms of devices and it's not a class issue as well.
Thank you very much, Jennifer. Actually, there have been quite a few comments also about refugees. So this will take us to the next question to Nico. Actually, there's been a comment from Ivan suggesting that refugees are among those groups that they cannot self-isolate. And this is very much the experience in Cyprus or Greece. So I'd like to invite Nico to tell us what can social workers do in order to support the plight of refugees in the context of the pandemic.
This is precisely one of the points. Oh, sorry, I need to unmute myself. Okay, this is precisely the point, is that the situation with refugees, I mean, if we take the Greek situation with the hotspots, in the hotspots, there have been many calls calling for the release of the kind of regimes of detention, rather than they're still being kept there. So this is a major problem, and there the conditions are not. It's not possible to self-isolate. I mean, self-isolate is they are in isolation, but the conditions there are not being properly observed, whether in Cyprus or whether in Greece. In Cyprus, we have done a report that shows this. We have spoken to many volunteers who are doing a lot of work, and social workers are many of the volunteers are actually social workers or unemployed social workers who work voluntarily in this field. So there is an issue of what do we do about that, and I think the first duty there is to really make representations. We're talking about advocacy here of allowing these people to access basic rights. There is an issue because there's concern that there are some people who are infected, and the issue is what do we do when and if there is a big outbreak of these communities in the confinement areas. But beyond the confinement areas, there are people who are actually do not have access to basic welfare, do not have access to health at all, and they are kind of living on the margins of society. I think there is a very important role for social workers to help in this process. Now, this is a situation where you and Michael have been writing about where the state has collapsed or has failed to actually address this issue. It's hands-on responsibility there. People have to take initiative and self-organize and help people to support their basic needs. So I think there is an enormous amount of work to be done there in this field, because this is also a public health issue. But at the same time, there is another point which was mentioned already by the other friends from different parts of the world. Homeless people. Many refugees are actually homeless. Recently, we saw the police in Cyprus going in and kind of saying, okay, you're not fulfilling the basic rule. You have 10 people living in one room. You have to fine you 300 euros. They can't find 300 euros. We have seen penalization of people who are actually giving volunteers and people who are actually activists who are taking basic material to these people. Again, they're being sanctioned and they're being forced to pay the fine of 300 euros. So I think there's an issue too, in that we are in a situation where we really have to defend basic rights, and social workers can play a key role in this process of not being part of this penalization and insisting that this is a question of need. And I think that there is, at the same time that we're doing all this practical work, we're so busy doing all these things, that it's crucial that we put things down in terms of what's going to happen next. And what's going to happen next is really addressing the needs. And the needs are changing. The world will not be the same after this crisis. The world is changing while this crisis is happening, and we have to be ready to respond. And I think it's not just one answer by one person, it's a collective action, and we can all do it together by actually deciding that we're not going down the path of the penalization, the path of trying to make this into a social control issue, but making it an issue of social solidarity, which is the basic value of the work that we can do.
Thanks very much, Nikos. And we've had a number of questions, a number of people pointing out the situation for child workers. That came from Gerald. Stipal asked about or notes about the issue of seasonal migrant workers and the difficulties that they have. So there's quite a lot of comments coming in about the difficulties that the people's in the margin of the labour market, poorer communities, excluded communities have, and actually practicing social distancing. And I think Nico's comments about refugees are equally applicable in many ways. My question, or the next question, has come from Dawn, and it's we're going to give this to Fatima. And Dawn asks, how can we use this period and this time to promote grassroots activism and community models of engagement?
Thanks, Dawn. I have to unmute myself. Thanks, Dawn, for your question. How can we use this time to promote grassroots activism and community approaches? One way would be to get involved in them. Social workers are also activists. Get involved in demonstrating how there is a different way of actually bringing about change in society, and that is about facilitating grassroots activists to be able to bring about some change. So you could do that as an individual, get involved, or you could do that as a social worker as part of your job. Some of the ways social workers have been working with us, for example, in our community, is to help with sharing resources, which we don't often have, identifying funding, helping facilitate all sorts of support and skills that they can bring to the to community activists that we don't necessarily have. Social workers, in my experience in Govan Hill anyway, are pretty smart people who have had a lot of experience working with community groups anyway, but they don't often see themselves as part of that community and often see themselves as a job, completely understanding. It can be very, very stressful, I know, but what this period has demonstrated is that through a partnership way of working, where we each of us bring our skills together, we can actually do quite a lot of good work. And I think we need to maybe remember that when we come out of this, that the activism has demonstrated that a new way of organising is actually possible at a grassroots level. But what we do need is we need resources and we need funding, and that's something maybe we can fight together within the community and not see ourselves as workers and activists, but actually see ourselves as all part of the same solution. Hope that answers your question.
Thank you very much, Fatima. I think what has been really interesting in today's discussion is how both participants who ask questions and speakers are always trying to identify and navigate the interplay between individual suffering and collective trauma, and also political interventions and how to support individuals and communities. The last question comes from Felipe, and we will direct this question to Robin because it's about Spain. And given that Spain has one of the highest mortality rates in the world at the moment, how do social workers address grief in the community?
Yeah, sorry. So it's a hard work to address the grief. I don't know if there's news spread across the world, but if one person dies in Spain by coronavirus, so the family cannot be with he or she on the burial. So it's a lot of times there is not a burial ceremony, and in sometimes just few people, like 4 people, can be at the burial. So we cannot do this dual process, and it's so hard Nowadays, some hospitals let to the family talk with the ill people through a tablet or Skype or video call. So it's so hard to do that. So in the worst moment of a person, you cannot be there. You cannot be together. It's so hard. We have implemented a telephone number to professionals and to people in general, just to get psychical and emotional support to do that. Also, Spanish Council have wrote and have launched several recommendations about how to manage those situations. Yeah, also recommendations to the people in general, and also for social workers that are working closer of those spaces of really rift. Yeah, that's the way. Thank you.
Okay, Ruben, thanks very much for that answer there. We've now come to the end of the meeting. We said it would last an hour and a half, and we're now at time. So I just want to bring the meeting to an end, first of all, by thanking a number of people. First of all, I want to thank all of you who have taken part online today. We've got lots of other questions that were being raised, and I would encourage you to keep those questions coming. If you're watching this later on through the video, please add the questions, and we'll try to shape future meetings around some of the questions that we've got from you. There were some questions come in later on about the ethical dilemmas of working in a time of distancing. There was a couple of questions about domestic violence, which we touched on 2 weeks ago, but I think we might want to come back to at a future meeting. The next meeting in this series will be 2 weeks from today. So on the 30th of April, there will be the next SWAN IFSW international meeting. Please put it in your diary. And at that point, what we're going to be looking at is what kind of social work might come out after the pandemic. So what kind of better social work are we looking to establish as we start to repair and reheal the world? If you're in the United Kingdom, however, or in Greece, next Thursday, there is going to be national meetings. So Greek SWAN are organising a meeting next Thursday. And in the United Kingdom, the British Association of Social Workers, the Trade Union Unison and SWAN will be online at 5 o'clock UK time for a UK-focused meeting about the pandemic and what social work should do in the UK. It just leaves me to thank the speakers. So thank you to Kerry, to Jennifer, to Kim, to Nikos, to Fatima and to Ruben. Thanks to Vasilis for co-hosting, and perhaps the most important person, the person who you never see, but for the last 2 meetings, all the technical stuff at the background has been done by Rory Anderson, so a particular thanks to Rory as well. Please keep your questions coming, and we hope to see you all 2 weeks' time. Thank you.